Time is now 7:10. I'd like to call to order the December 19th, 2018 meeting of the Tilton Budget Committee. We'll start with the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our next order of business is the meeting minutes. The copy is on the commission. Chance to look them over, please. One correction I see is on page 2, first paragraph. Brittany said lots of requests for child care needs. I think we should say there are lots. I don't see anything else. Does anybody else?
What was that again?
Last paragraph on page 2.
Yeah.
Bill Lawrence asked for trends. Brittany said lots of requests of child care needs, and I put in said there are. Lots of requests of child care needs.
Oh, okay. All right.
Okay. Anything else? Well, I'll make a motion to accept the minutes as corrected.
Second.
All in favor?
Aye.
Aye. Opposed? Good. And our next order of business is to hear from Child and Family Services, and Paul, who's representing them, is unable to attend again. This is a very busy time from, I see that on social media, so he asked to reschedule for the January 2nd, and I think Marina has scheduled him for then.
Tentatively.
Of January, correct?
Yes.
Okay, so I'd like to invite Sandy up to talk to us about childcare. For those of you who don't know Sandy signs your stipend check, so be nice to
Oh.
Yes, please, Sandy. Thank you.
Okay, and I haven't met all of you.
All right, Christine,
Christine Novitsky.
Jane Alden.
I'm John Campbell.
I'm John.
Bill Lawrence.
I'm Sandy Hislop, and I am here to advocate for advocates. And I'm not a staff member, I'm an advocate myself for CASA, which is the court-appointed special advocates, or the guardian ad litem for abused and neglected children here in New Hampshire. It's a very vulnerable population in New Hampshire, and there are 573 of us doing the job that would ordinarily cost the state to hire regular lawyers to be the guardian ad litem for these children who are abused and neglected. We are advocating for 1,400 plus children in the state, for 867 families But in our area, right here, in the Franklin Family Division, Tilton has about 11 children in 2018, and CASA estimates will have about a little increase, or 12, for 2019, with 53 to 55 overall in the Franklin Family Division. I happen to work out of the Merrimack Division because I started when I was working full-time for the state in Concord. So I don't work up here, but I do appreciate that there are advocates for our children here as well. I understand that you received the information about CASA and their budget, since I know so little about it, but I am happy to take any questions that you may have on it and get back to you with answers. One of the questions you asked last year was how many staff was covered by the payroll line of the budget, and this year it is 30 staff members. Those staff members are my supervisor and attorney that we have on staff full-time, as well as several trainers who help people like me and prepare us for going into court to make sure that we follow legal protocols and write reports correctly and so forth. The training that they give us is marvelous, and they update it so that we don't get behind a lot. Yes?
Could you just give me an idea of what your job actually is?
Okay.
Yeah.
I am assigned a case of an abused or neglected child.
Okay.
And I go visit that child, learn about the case, and immediately, because as soon as they remove a child from a parent's home, or if they find an abuse and neglect ruling, they will take it to court. So within a week, we have to go to a preliminary hearing. Then there's an adjudicatory hearing if the judge thinks that there is merit to what's happening. I work a lot with DCYF, a lot with the parents, but mostly my job is to observe and make sure that the best interests of the child are being served. So it's probably a year plus commitment, and they ask you to commit to the case when you take it. Often it's much longer than that, but it's at least a year usually, and there are court hearings every 3 months that you must attend. I visit the child at least once a month to make sure I know what's going on in that child's life. And then I write reports to the court to let them know that the child is receiving medical, is in a proper home, if it's a foster placement, that type of thing.
Okay.
I just had the fortunate experience of taking the case all the way to adoption with a Northfield family last year. It was
Wow.
wonderful, just wonderful.
How long
So
did that take?
there are some good things that happen here.
Is
Pardon?
that over a long period of time to go through that whole process?
About 3 years to get to the adoption, which happened in November. So it was a good feeling.
What's the average age of the children you interact with?
That's a good question, and I personally have asked my supervisor to ask me to take cases of younger children, because it goes all the way from newborns to 18-year-olds, and usually at 18 they age out of the system. I prefer working with babies or toddlers or the younger children and find that my comfort zone. And there's enough variety of us advocates so they can usually do as you request.
Have you noticed an increase in the need for your services with the opioid crisis?
Absolutely. We were almost to full capacity capacity. We're almost to the place where we could take every abuse and neglect case. We were at 94% of the cases we could take. Now we're down to 85%, just because we've increased advocates, but the number of cases has increased so much that it's been devastating. Indeed.
So there's 11 cases in Tilton right now, did you say?
Yes,
Yeah, okay.
that is the statistic
Yeah, yeah.
that is in the paperwork, yes. I, of course, would only know about my own.
And you don't know the total number of cases that are in the system right now?
The paperwork says, no, not right
Yeah,
now, because they're in and out on.
Okay, yeah.
Yeah, but it's about 1,400 children or 800, yeah.
And do towns usually, I don't see much of a breakdown of other towns.
Mhm.
What is are all the towns giving money, or how does
Okay.
that work?
That was another question you asked last year, so I'm prepared. Okay, the town of Alton gave $1,000, the town of Belmont $500. This is just Belknap County.
Yeah.
Center Harbor, 500, Gilmanton, 500, and Tilton gave 500, but I think we're asking for 1,000 this year.
Yes.
And we need it.
Is that because of the increase in the number of cases?
Yeah. And we're trying very hard to recruit advocates all the time, train them, and keep that training up to date.
Do you get any money from the county, Belknap County?
No.
Why do so few towns give?
I can't answer that.
I'm sorry, Bill, what did you?
Why do so few towns give?
It's such a worthwhile program. I can't imagine
I
why
mean,
they don't.
you must get most funding from federal or something, right, or state?
Yes,
Yeah.
yes. And private fundraising, they do a lot of fundraising, yes. So if there are any questions?
You mentioned how much it saves the state, what was that number again?
I'm not sure.
573 people they have to save the attorneys.
Right, it would save the attorney's
okay,
fees
okay.
of that number, yes.
How do we compare to the other Belknap County people who actually did as far as number of families or children you serve?
Yeah, I don't have that statistic. Don't.
And I know you said you can't answer anything financially, but I can see the assets are way up. And they're, I can't see any liabilities, but you're going from, in 16, from 387 in one checking account to 763 now. So it seems to me they're not spending as much as, and all these assets are way up.
Okay. I can ask about that and get back to you.
Yeah, maybe provide the liabilities. Yeah, that's current. This is a balance sheet. That's year to year.
Yeah, this shows the profit and loss.
Right.
And
So they're
I
not,
think one of them only shows the profit, the incomes.
right, but the profit or loss is the income and expenses for that year only, so either they're getting all this extra money from their stocks or investments or what, but they're way up.
Which page are you on, Christie?
I am, page 2.
Be here.
But they don't have the liabilities there, so, I mean, they could have a big note that they pay on, I don't know. But their assets are steadily going up. Just from last year, we're talking over 200,000 in one checking account. Or if you look at the bottom line for checking and savings, they're up $400 million, or $400,000, excuse me. I'd like to say 400,000, but, so they're saving and they're getting money, keeping money in there. They're just spending, it looks like to me they're spending just year to year and everything else is steadily increasing.
I can get an answer for you.
Sure, yeah, that'd be
Yeah.
great.
Yeah.
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 Because the liabilities would show they have a big note and you have to pay liabilities. So,
Mhm.
yeah.
And I found the answer to my question. CASA volunteers saved the state $4.8 million in legal fees.
Wow.
So are you paid or? you're-
No,
Okay,
I'm
that's,
totally volunteer.
well, good job.
Yes, we don't even get reimbursed for gasoline.
Yeah, the emotional toll must be hard sometimes.
If you look at that letter from the president and CEO,
Yeah.
at the bottom, it shows you what towns and cities contribute.
Franklin's not on there, Guilford.
She said Guilford, I thought, yeah.
No, it's in Gilman.
Gilman.
Yeah.
Is Northfield?
Northfield is in Merrimack.
Oh, that's
so
right.
it doesn't
Okay, I know.
necessarily have
I
that.
haven't seen them.
Yeah.
Looks like we gave 1,000 last year, not Franklin.
Yeah, Franklin's in Merrimack too, right?
I believe so.
Yeah.
So it looks like we're counting, because this says we gave 1,000 last year. too. It's an 18.
I could have.
We gave 500 for many years, I know.
Yeah. Not sure exactly.
All right, any other questions?
I appreciate any consideration you can give us.
Okay,
Sure,
very
Thank you very
good.
much.
All you do.
Thank you.
Email address so I can send you an answer. Oh, yes. Sumzinger, SUMZINGER, 57 @gmail. .com? Yes. Okay, which one was it?
Monumental Genesis, right?
HY.
Genesis, is that monumental health or is that?
Oh, yeah.
Oh, that's what the monumental health is, Genesis?
Is it?
I wonder if I'm-
SUMZINGER. GER.
Gave us a worksheet.
Sumzinger.
Oh, got it.
Got it. Can you get my phone number for you to call me? Right?
No.
196 5972. And it's
Unfortunately, they didn't get moved
MARIA.
up.
Right,
Marie Sumner.
Yeah.
they usually get a little early anyway, don't they?
Hmm?
They might be here by 7:30.
Yes. Good. We'll do it together.
Thank you.
Thank you.
It's a
Good night.
Holidays.
Thank you.
More
Night.
person. Still trying to put it all at the same time.
Well, I don't think there's gonna be issue
Yeah, so it was first, so.
because wife didn't, they, let me just call.
I don't think I have Genesis, I have Lakes Ridge and Menlo.
That's it.
Oh,
They changed their name. Marina, you haven't heard anything from Hall Library, have you? Because remember Pat asked them to make a presentation on a child librarian?
yeah, I do.
Pat Constantino asked them to make a proposal for
To add the child.
a child librarian.
Oh, okay, yeah,
And they were
specialist.
supposed to get back to us.
Yeah, yeah. How much that would cost to add that?
Yeah.
They were saying it was like around 80 or
Ah.
something.
Lakes Region Mental Health?
I am.
Well, if you don't mind starting early.
No, not at all.
Start, you can at least take off your coat.
Thank you. Nice to see you all again.
I know. And if you, we have a lot of new members, so if you would
Sure.
introduce yourself, and then we'll introduce ourselves.
Sure.
Christine Dubnitsky,
How are you?
Jane Alden, I've met you before.
Yep.
I'm John Scanlon.
Hi, John.
Bill Lawrence.
Hi, Bill. Nice to meet you. And I'm Ann Nichols. I'm the Director of Development and, Public Relations for Lakes Region Mental Health Center. So I don't know what questions or if you just want me to kind of do a spiel.
Do a spiel.
Do a
and then
spiel?
we'll ask questions.
Yeah.
But let me ask first, how'd your move go?
It was organized chaos, but it went very well. We moved on New Year's weekend.
Oh,
And if you remember, it was like 20 below. And so, yeah, it was it was interesting trying to move that many people and everything that goes along with it into one building, especially when the elevator didn't work and they were painting in the stairwells and yeah. So, but we're so glad to be there. It's a much more efficient operation now, so thank you for asking. So I don't know how much some of you know Lakes Region Mental Health Center. I'm not sure what your comfort level is with it, but
formerly known as Genesis.
right, we're formerly known as Genesis Behavioral Health, and in conjunction with the move that we made a year ago, consolidating 4 locations into one, we also adopted, or readopted, I should say, our legal name, because our legal name was always Lakes Region Mental Health Center, Inc., doing business as Genesis. So we just dropped the DBA, and we had a number of reasons for doing that, but so people are still getting used to that name change, but we were founded in 1966, so this is our 52nd year of being in business. We are a private, nonprofit organization, and we're designated by the state of New Hampshire as the community mental health center that serves Belknap County and Southern Grafton. And there's 10 community mental health centers in New Hampshire, spread out all over. I think the closest one here would be Riverbend in Concord, which I know you're familiar with, and we do a lot of crosswork with our patients too with them. So we offer the full range of mental health treatment for people who are living with or recovering from mental illness, and that goes way beyond counseling. We offer supported employment for people who want to work and gain gainful employment. We work a lot with children in play therapy. We have of the 4,000 plus patients we served last year, over 1,000 of them were kids under the age of 17 on down. I think our youngest is 3. Our oldest adult is 94. So we work with veterans, we work with the elders. We also do what's called in-shape, which means people with mental illness oftentimes also struggle with maintaining good physical health, and you can't have a good mind without having a good body. So we help them integrate into some sort of health program, measure heart rates, body mass index, those kinds of things. So there's an awful lot that goes into what we do. There's a lot more I haven't talked about. So last year, as I said, we served 4,067 kids, adults, families in the Lakes region, and we provided collectively $1.2 million in charity care. Charity care is defined as services that we provided, but for whatever reason we didn't get reimbursed for, either through Medicaid or by the patient or private insurance or self-pay, those kinds of things. We're mandated by our contract with the state of New Hampshire to provide emergency services to all 24 towns in our catchment area. The challenge we have is that the state doesn't really provide funding for that. They say you've got to have master level clinicians and psychiatrists on staff 24/7, like you might have a firehouse full of firefighters, but we're not going to help you pay for that. So our emergency services department always has and always will be a loss leader. I mean, we just to give you an idea, last year, what was it? We generated $492,000 in revenues from our emergency services, but it cost us $898,000 to operate. So that's a pretty big deficit, $405,000 plus. So, but we do it, and we treat anybody that comes through the door regardless of ability to pay. So they might access emergency services by calling in on our crisis line, which is a 24-hour service. Goes right to our emergency staff, which is located in Lakes Region General Hospital. That's their physical location. They also operate, of course, the designated receiving unit here at Franklin Hospital. And we also serve the ER at Spear Memorial Hospital up in Plymouth. So they might walk in to the ER at the hospital. So if that were to happen, then the patient is medically cleared first by the ER staff of the hospital to make sure physically that person is stable, and then they're turned over to our staff. So we have office hours and what have you in the hospital, in the medical office building that's adjoining to the hospital, but our staff frequently is called down to the ER to deal with issues. We're also called in to work on cases if there were ever a community tragedy, and we've certainly heard enough of those going on in the United States throughout the year, that we would be called in to do debriefing or provide support to either the staff of a business, school system, the kids of a school system, that kind of thing. So the challenge we have is that last year, when I took a look at the numbers from 2017 to 2018, we had a 39% increase in the number of people we served in emergency services. I think in Tilton, I actually brought last year's numbers. You didn't really go up that much in the ES.
Is that the opioid crisis?
Well, partly that's it. That breeds its own. The interesting thing about the opioid crisis is that someone that has a substance misuse disorder usually has an underlying mental health issue, and both of those things need to be treated. But not everybody with a mental health disorder has a substance misuse disorder. So because the opioid crisis has certainly affected the Lakes region significantly, it's impacted our resources too. But I also think people are becoming more aware that that's available to them. And our whole goal is to keep them out of the ER, keep them out of New Hampshire Hospital if we can. So our ER staff actually works very closely with some of our community partners like Navigating Recovery, some of the substance misuse folks, organizations that can provide those services, because you need to be a licensed alcohol and drug abuse counselor to do that. And we do have at least one on staff in our right now, but it's very difficult the workforce shortage is very difficult to recruit them because oftentimes they can get higher salaries by doing that elsewhere. So it's kind of an interesting conundrum that we're in. When we go to the towns, 19 of the 24 towns that we serve do support emergency services, just so you know that. We do try to do fundraising as well, and I think the financial package I gave you kind of outlined that. Although I will say that in this our fiscal year ends June 30th of 19. And we were running into a problem where the town funds don't come in until often that time frame, sometimes after the town meeting and once, town officials have settled out the budget. So for the fiscal year, for this coming fiscal year, we're actually not going to report the money that towns give us. We're going to delay it so that we're actually reporting it when we receive it in the same fiscal year. But we generally raise about 118 to 120,000 right now collectively from all of our towns.
That's not on this budget, right?
Right.
Yeah, I thought I noticed, where the heck is it?
Yes.
See it, yeah.
And that's why we didn't put it in this budget
Now,
for
in the
this year.
past, you've gotten money from Belknap County. Why has that changed, you know?
Belknap County has not funded us for the last 2 years. I will say that it was in the interest of the delegation to minimize tax increase or eliminate all tax increase. So they didn't fund most of the outside, what they call outside agencies, which I would argue with because we provide medically necessary services to Belknap County residents. And I don't really know what to expect from Belknap County this year. I attended their delegation meeting, and the executive committee of the delegation will be going through the budget and making decisions based on what the commissioners have already recommended that they fund. And of course, the commissioners support us. But so until that philosophy changes, I don't really know what to expect from Belknap County. Grafton continues to fund us and be very supportive. They've funded us without fail every year.
How do you determine what you're asking for from municipalities?
That's a good question because we've got a census coming up soon, 2020, I think it is. And so our census, we took the 2000, I don't remember which census, I think it was the 2000 census. I don't even think we updated. But we take a look at the percentage of population in a town and what percentage that is of our entire catchment area. Then we calculate what portion of the ES deficit we would like to have towns fund. We've always used $175,000 as that dollar amount. We've never ever gotten it. In fact, we don't even ask for that much. Usually we ask for about $155,000. So it's all prorated based on a town's population and the population within the catchment area. So that drills down. We take that $175,000 and go down from there.
Because you had a couple big ones denied for the prior Barnstead and
Yeah.
Sangerton.
Yes.
Do you know why?
There just isn't a support for it, unfortunately.
Typical Sangerton Valley.
Yeah, and Barnstead, the same thing.
I'm not familiar with Barnstead. I am with Sangerton.
Yes, well, yes, because you're almost neighbors.
Yeah.
Yeah, Center Barnstead has always been a difficult one. Campton had never funded us until last year. So
We did it for a long time.
I know you didn't. And we've been very grateful for your support. But, I think it takes a lot of educating, and I think it takes an approach at looking at the long-term picture.
I can't address the others. I can Tilton. we have seen a change in your service.
You have,
And,
for the better or for the worse?
better.
For the better, good, well,
That's why you've been late from us now.
we would want to know the opposite, and you've always, Jane, you've always told me, and
Yeah.
you've called Maggie, and,
Yeah.
and so, but I'm,
I have your phone, your card on my desk, by the way. I haven't had
Good.
to call you though.
no, you haven't, and that's a good thing,
Or
but I,
Maggie this year.
no, and, but you know that that line is always open to you, if you ever had,
I almost called you once. I am not, I'm your rehab service. For somebody who did not have a mental issue.
oh, okay,
She had heart surgery and then came to your rehab.
okay, all right.
Now, since the consolidation, the other places you came from, were those rentals or ownership?
Both. So our child and family services were located in a building on North Main Street. That building is currently up for sale. The adult services on Church Street, which was the larger of the two, that building is also up for sale. The two rental locations were to house us administrators. The finance, the IT, the executive director, well, she actually went up to the hospital. She got moved around about 4 times, but that's typical. The business office, we were spread over 2 rental locations on Water Street and right on Beacon Street West. So it's in the Hector's building. The Hector's, we were located right next to Hector's Restaurant. And then on Water Street, it was on one of those side offices there. So those are now, I believe, being occupied, or they're soliciting for new occupants. So we do have some prospective interest in both locations that are up for sale, which we're hoping will sell soon because we'll be using that to pay down the debt that we took on in order to renovate the old Health Link building.
Well, they both have mortgages too, don't they?
Church Street, Church Street does. North Main Street is owned outright. Yeah. Yeah. So, yes, we'll be very glad we don't have to carry those costs.
So you did 4,067 emergency services in the area?
4,067 was total patients.
Yeah, for the Lakes Region area?
Yes.
24 towns?
Yep,
Yeah, okay.
yep. And,
Tilton.
Now, are you mostly phone service, or how, I'm not sure exactly.
for the ES,
How your program works?
for emergency services,
Yeah.
someone could call in on our crisis line, and they would be directed, depending on the situation, they would be directed either immediately to the ER, where our staff would meet them, or if it was a situation that could wait to the next day, then we would meet them in the office and do it that way and try to bypass the whole ES thing, because that's the most expensive way that a person can access services, is to go into the ER. So wherever we can direct them to, and to keep them out of there. Plus, it's not a very conducive, it's not a space that's conducive to be a healthy place.
ER is your ER? Or
No, it's the emergency room at the hospital,
Lakes Region?
Yes.
Hospital? Okay.
or Spear,
Okay.
or
Oh,
Franklin.
Any of those?
Any of
Oh,
them,
okay.
yeah.
Yeah, those aren't great.
Right. They're not a good place for someone who's having a mental health crisis to try to help them. So we try to get them out of that situation. And so I know in Franklin we've been trying to do more face-to-face consultations and evaluations as opposed to using technology called telehealth. Which is a technology that a lot of medical firms, professions, including physical health, are using now, because to try to have staff in such a large geographic area, it's hard to cover. So if someone were in crisis and they needed an immediate psychiatric evaluation, we can actually do it through telehealth, where it's sort of like, what's that new Facebook thing that they're doing? It's
Right, that portal thing?
portal thing,
Yeah.
exactly.
Okay.
Where you're sitting in an office space that's quiet and private, and you're having a private conversation with the physician or a master's level clinician right then and there. So it means that people have quicker access to care. But there are certain folks that don't like that, and I can understand that. So we try to accommodate them by arranging to have face-to-face wherever possible. So
We didn't like that.
I know you didn't. Yep, no, you made that known. So we've been trying to address that. Our challenge is the workforce shortage. And it's not just us, it's everywhere you hear on the news. Every profession, every business is having trouble recruiting. For our profession, one of the issues is that we have such low Medicaid reimbursement rates. So if you've looked at our financials, you'll see that 70% or more of our revenues come from Medicaid. And when we're paid a Medicaid rate, but either the difference can't be made up, either because the patient doesn't have the financial resources, that becomes charity care. And we're unable to hire people at a salary that's attractive. So it's easy for us to lose people in our profession to other states where their reimbursement and their salary rates are higher, if that makes any sense. That's kind of the why behind it.
Yeah, makes sense.
I know
We used
this,
to lose police officers constantly to Tony, when I was on budget for years ago, because of the pay, yeah.
yes,
And the firemen?
Right.
firemen, same thing, yes. Those are good examples.
People start out, get a lot under their belt, and then move on to get a resume built up. So
Yes, we
You get a
do.
turnover.
And we
There's
become the
burnout.
training ground.
There's burnout in your workshop.
Yeah, they call it compassion fatigue. And so we have actively addressed that by having our employees, we do a lot of training sessions internally, as well as for other community organizations, because anybody that deals with the substance misuse population, the lower income, it does wear on you. So that's one of the beauties of having the new space that we have, is that we have room now to be able to do those kinds of trainings for our own staff, as well as for the community at large and other providers. So that's been a big help. But yeah, we become a training ground. A lot of folks do come out of college and with a master's, and their salaries are maybe $30,000-$35,000. That's not a lot of money to live on when you have a family to support. So
Okay, any other questions?
Do you know what the rate is that they reimburse for Medicaid?
it depends on the service. If you would like, I could send the fee schedule.
Well, what I was wondering is the charitable care amount, those amounts, what is that fee? How do you determine that amount? Is it by the hour?
Well,
How many hours times so many hours?
It depends on the treatment. Some treatments are done by hour, but a lot of our work is done by units, and a unit is 15 minutes. So that would include, prescription monitoring for people that are on medication, because we have a pharmacy in our location as well. It would provide check-ins periodically. Patients need to check in. It's not a whole hour that they need. So it really depends on the service that they are accessing. The rates are all different for all of that. There's case management, and then there's, which is a care plan, if you will, that might involve a physician or a clinician a therapist, someone who works with supported employment, for instance, someone who works in some of our other departments, so that they provide wraparound services for a client as they become healthier.
So that
it-
amount is, it's not just a flat rate?
No,
and
I wish it were that easy.
Yeah.
No.
Well,
And we
I'm
deal
glad
with
it's not
two,
that easy, 'cause
yeah.
it's nice to have easy, but it's more accurate.
Right, right. So that would include people who, because we also offer sliding fee schedules. So we do have people fill out financial affidavits, and then we adjust the pricing for them based on that. We also have people on staff that will get people enrolled in Medicaid or in other insurance if they qualify for it. So I mean, there's a whole lot of services underneath just the therapy that we do and the group therapy that we do, to try to get a client the coverage that they need. Yeah. Medicaid expansion has been good in that more people access care. But I've seen a significant bump up in our charity care too.
Because you can give them more care, but it's not fully reimbursed.
That's right. Yeah.
Yeah.
So it's a
All
kind of,
from
yeah, right,
It's helping more people, but it's hurting.
right.
the financial-
But we're still a supporter of it because it's needed care. So
So
That's
the-
a good question.
The other services besides emergency are just regular?
Well, we have child and family services,
Mhm.
then we have adult services, and we keep those populations separate.
Is that basically counseling type of stuff?
It can be short-term, it can be long-term. There are those that have severe and persistent mental illness, and that would include people with various degrees of bipolar, schizophrenia. Some have dual diagnosis, so they have a mental illness like both bipolar and a substance use disorder. So we have to treat both of those. So there's a lot that goes on. There's individual, there's group therapy, all of that. So, yeah, our clients are there for as long as they need to be, so.
And the therapies are mostly done at hospitals, did you say?
No, the hospitals are done in our facility.
Okay.
Yeah. The hospital is only used for emergency services. We do have office hours there for people who are needing emergency services but don't need the ER. They don't need physical clearance
Okay.
because of illness or injury. Yeah,
Thanks.
good questions. It's a very complex business.
Yes.
We also do what's called CIP. It's a business is filled with acronyms, so if there's something you don't understand, just ask. But in the state of New Hampshire, divorcing parents are required to go through a course on how to manage their divorce and how that impacts their children. So we do all of those classes too. So when the court orders that, they come to our facility for training sessions, usually in the evening.
So if any contested divorce or something,
Anybody who's getting a divorce and is a parent,
and even if they're doing it amicably, they still have to do it.
they all have to go through it. And having gone through that myself personally, it's very good. It's a very good program because sometimes kids can become the weapon
Sure.
between two parties, and that's what we try to mitigate. So, yeah.
Thank you very much.
You're welcome. If there's anything you think of after the fact, please don't hesitate to reach out. Jane knows how to get in touch with me. Be more than happy to answer your questions. Thank you for your time this evening.
Thank you. Are we meeting next Wednesday?
No.
I asked because we had the planning email, that's why I had to ask.
I know.
Thank you, Ann, for coming.
Wasn't the secretary having the party?
And I can go that day.
Yeah.
Planning board, so, okay.
I'm at hope we can do some of it tonight, but I don't want to do it with so few people.
Thank you.
Yeah.
But for our next meeting, we'll have a heavy meeting
Answer to most anything.
because Heather Thibodeau will be in,
Great.
and we have Child and Family Services. But look over your list of solicitors of funds, because we'll start voting on some of those.
Yeah, I copied somebody, I think I copied James last week.
Yeah, okay?
Yeah.
Secretary has this form.
I gave her part of it, but I'm,
Do the actual computer file.
I asked Jeannie to ask Johanna if she had any folders or files that we should be able to.
Does that mean?
Including electronic.
Yeah,
Yeah.
yeah,
That would be-
Jeannie was going to do that, I said to Jeannie, I don't think it would be a good idea for John or me to ask. I don't think we're the most popular.
Yeah, that would be nice and we can fill them in.
Yeah.
And maybe when we send out the next agenda, mention that we would like to vote on some of those, so we get more people to show up. There'll be some voting going on, so when you send the email, I put that in.
That we will be making
Voting.
decisions.
Yes.
And Allison Hartwell Stewart is going to send me a letter requesting that they not come in because she had to let the foot surgery.
She had hand surgery this
Yeah,
fall.
and now she's had foot surgery.
Foot surgery, and she's in.
And
Wow.
Chris Meinhold's having some issues too, so that's, I asked her to send a letter requesting it.
Sure.
What's the date of the next one, Jane?
Well, that's what this is.
The second,
She said that.
What was that?
I don't know.
Well, that was their
she sent that in,
request, but there was
she
nothing.
sent that in October,
No one came in to support.
but no one came in, and that's because
And although
Chris was having issues,
Northfield had asked if they could be excused from, since there
Yeah.
wasn't funding, and,
but I called Allison, and Chris was having mobility issues too. So that's why he wasn't able to come that night, but he didn't realize he needed to call, so. Okay, well, I asked her to send something in
I
writing.
think it's pretty straightforward.
Yeah.
I mean, their family contributes
A lot more.
anything
Yeah.
that's not covered, so
And they submitted their
it's
application
less than
time.
level
Oh,
funded.
yeah, they did.
yeah, and it's a great event, and it's a great
Oh, I agree.
local.
Yeah. Yeah.
Now, the Old Home Day, and that's what I was concerned about, although we level fund it, we do that every year, sometimes in a year they end up with extra money left over because they canceled fireworks or saved money on something. And in the past, we've adjusted a little bit to cover for that, but always made sure that they had sufficient
I
seating.
think they did send us a breakdown, didn't they?
Yeah, they did.
Yeah.
I think that was an issue with the treasurer at the time, that now they have another treasurer who's pretty much on top of things.
Yeah, one year they got a new trailer or cargo.
Yeah.
Yeah.
They're pretty straight, yeah. they tell
Yeah,
us.
a few years back, they had canceled the fireworks and didn't get billed for it, and then they held that money over.
Yeah.
So we subtracted the money in fireworks in the previous year, a
Okay.
portion of it to cover for it.
Yeah,
So,
but they didn't tell us that was an issue.
yeah, so that was
Is there
adjustment
anything
that
else?
was made.
Motion to adjourn?
Motion to adjourn, I'll second that. All in favor?
Aye.
Aye. Opposed?
I move we all have a great Christmas.
I think
you're
that's a
so-
great,
Unanimous.
I think it's a great
I
idea.
kind of want the holidays to be over.
I know, it's always, it's the hard, I love Thanksgiving, and Christmas is so stress-inducing, just.
Yeah.